A new dawn is here, a paradigm shift in peri-anesthetic organizing systems. A revolutionary device designed by an anesthesiologist for improving efficiency and safety in and around the operating room and around hospitals. Introducing Bedside Buddy by Bedside Buddy LLC, with two main models in the Bedside Buddy Organizer series. The Deluxe model, which is the anesthesia model used solely in the operating room area and designed specifically for the anesthetist. The Economy model, which is for use outside the operating room by medical professionals for placing intravenous lines, drawing blood, and performing intubations. This model is a simplified version of the Deluxe and can be purchased with or without the rolling stand. It features an inbuilt clamp that allows for the whole unit to be quickly stabilized on any IV pole and at any convenient height chosen by the medical provider. The optional rolling stand gives the extra advantage of having the unit permanently mounted and ready to roll from its centralized location to the procedure site. It is always fully stocked for your intravenous lines and arterial lines if stocked for that purpose. The clamp on the unit allows for quick adjustments to the height desired, placing all items needed and the garbage bin at the most optimal position for the user. This model comes standard with removable interior dividers that allow for the same unit to be converted and used solely as an emergency intubation box if necessary. The Economy model can also be utilized by phlebotomy for blood draws utilizing the long arterial catheter compartment as a compartment for all extra blood tubes drawn in excess of the obvious 4 blood tube holders. With this model, it is now possible to place an IV, draw blood, place an arterial catheter, perform a central line cannulation, all in organized and slick fashion thanks to this revolutionary product. The Deluxe model was designed to facilitate all procedures performed by anesthesia providers and improve intraoperative efficiency and safety. Bedside Buddy is an ergonomically designed, multifunctional portable unit that quickly stabilizes in an unobtrusive fashion in the most optimal position for the anesthetist, at the same time providing him with all the essentials necessary for the task at hand. The anesthetist's Bedside Buddy features two separate units, the mother unit and the baby unit. If an IV of arterial catheter is to be placed during the case, then the baby unit may be docked within the mother unit if so desired. The baby unit may be kept separately on the anesthesia cart if it is not needed. In that situation, the mother unit alone centralizes all functions of the anesthetist, allowing for improved organization and streamlining as well as improved safety. For example, when seconds matter, having succinylcholinate easily and readily available in front of the anesthetist will decrease mortality rates associated with laryngospasms and resulting negative pressure pulmonary edema. Before each case begins, the baby unit is removed for restocking and placed on the main anesthesia cart. The mother unit is also initially stocked with all drugs necessary for the case. If the facility uses a Diebold system, then the mother unit is carried to the Diebold, the easy load door is opened, and all medications needed for the case are placed onto the Velcro pad in the mother unit. These medications are easily transported back to the operating room. The mother unit is opened and the medication is drawn up into syringes, then locked up in the locking compartment provided. It is preferred to cap all syringes with a monoject smart tip needle or preferably with the Coleman Lure lock caps. The anesthetist always keeps the key to the medication compartment, and a spare key is always located at the centralized location in case of loss. The mother and baby unit can now be easily stabilized on the side rail of the OR bed ready for use. Ensure that Bedside Buddy is well stocked with everything you need for the case. M-MAIDs. M. Monitors hanging off the specialized multifunctional hook. M. Machine checked. A. Airway equipment. Laryngoscope, endotracheal tube positioned in the holder. I. Intravenous and arterial line supplies. D. Drugs drawn up within the locked compartment. S. Suction positioned in the suction holder in front of you and easily accessible. Bedside Buddy is designed to be easily repositionable between either side rails thanks to the innovative clamp and bridge system. It can also be positioned and stabilized by an IV pole thanks to the innovative swiveling clamp. When the patient arrives, everything that you need is positioned exactly where you need it. Induction. Proceeding with induction and intubation is a slick and organized process since everything needed immediately for the task at hand is ergonomically positioned and readily available. Before, during, and after induction, Bedside Buddy serves as your personal assistant in performing all procedures. Arterial catheterizations and placement of IV lines become very organized. Simply pull out the baby unit from within the mother unit, stabilize it on the arm board with this innovative swivel and slide base, and proceed with the procedure. Everything you need is at your fingertips. Now simply perform your procedure. Disposal of trash generated is easy since Bedside Buddy provides for a disposal bin for both your sharps and non-sharps. Dispose of your garbage as soon as you generate it. The system for garbage disposal is truly unique. The garbage bin contains a plastic insert which can be used as a garbage disposal either on its own or can be lined with a disposable plastic bag. By doing so, one eliminates the need to clean the bin and plastic insert regularly. Once the procedure is done, pick out the garbage bag and toss it away. For larger, bulkier garbage, a quick deploying suspending garbage bag system is available for use. Simply swivel out the arms and hang a large garbage bag to give you immediate access to a large garbage disposal right next to you. For central line placement, simply swivel the work tray out of the way. Place the kit onto Bedside Buddy, open it, and secure it with the spring-loaded arm provided. The kit is placed in an optimal position at the same time supplying you with a sharps disposal unit and non-sharp disposal. The large garbage bag suspended from the swiveling arms is in a perfect position for all your trash. After induction, easily secure your anesthesia circuit with any or all of the telescoping anesthesia circuit holders provided and with the small circuit holder below the unit. The non-tubular telescoping circuit holder features two IV stabilizer slits to keep your injection ports within easy reach at all times. The tubular swiveling and telescoping circuit holder serves many functions. It can position the endotracheal tube between the top loop and the base of the mother unit, allowing for the endotracheal tube to be placed in a ready-to-use position. It can also be used to hold your face mask prior to induction. It serves as an A-line, CVP, PAP transducer, positioning and stabling system. It sets the standard for transport of critically ill patients to and from ICUs by allowing for a smoother transition between beds and during transport. The unit easily clamps onto the travel IV pole thanks to the innovative swivel clamp. During transport, the mother unit, while attached to the travel IV pole, serves as storage for all emergency items needed during the transport. The transducers stay attached to the mother unit during the transport and are easily adjusted to optimal height to reduce errors in BP readings during transport. Bedside Buddy does it all. It also provides a tray for your nerve stimulator, supplies you with a tape dispenser, and frees up your work area for charting. On emergence, it ensures you always have your suction strategically placed in the most optimal position and ready for available use at all times. This decreases risk of aspiration by always being readily available for use. Bedside Buddy supplies the anesthetist with all emergency items needed in the event of emergence gone bad. Prior to emergence, have your oral airway, succinylcholine, readily available on the work trays provided. This device is perfect for all residencies and teaching programs to teach all residents and future anesthetists the importance of planning ahead and being ready for the unexpected. Finally, one device that does it all. Get rid of the clutter. Welcome order. Get reorganized with Bedside Buddy. Ask yourself the following questions. Have you ever misplaced hardware during the critical moments? Have you ever used the body of your patient as a work surface for used and unused IVs, syringes, needles, and airway management items? Have you ever littered your patient's bed, floor, or immediate surroundings with hazardous materials? Have you ever wondered where to put certain key items during patient transport from the ICU, or ever placed these items in odd places? Have you ever wondered where to place your central line kit? Would you prefer to have your suction in front of you at all times or behind you most of the time? Would you like another well-organized anesthesia tool to make your existence in a highly charged environment less stressful? If the answer to any of these questions is yes, then Bedside Buddy is for you. Let us all do what is right for our patients and embrace 21st century organized anesthesia so we can provide a higher standard of patient care.